Assalamu alaikum warahmatullahi wabarakatuh. I welcome all of you on board. And the purpose of this discussion is to just highlight some of the growing trends in our medical profession, and just to
Is it
like
on? You know,
maybe some of you will be surprised that an anesthetist talking about medicine, surgery, pediatrics. So, can I get who among you is working in US, UK? Any one of you, if may I know if any one of you is working in Europe or America? Okay, any one of you who is in internal medicine? May I listen some feedback from any one of you? Are you are you listening me? Am I audible to all of you?
Yes, yes, you are audible. Hello. Good evening.
Where,
Yeah, I am in internal medicine now, practicing as a general practitioner. I'm
where
preparing
are you
for
working?
MSc
Where are you working?
in Russia. Russia.
Oh, it's nice. Mm, okay, so Dr. Abdullah
Yeah.
is your okay. So actually, I just give me a minute. I'm just resending link to some of the groups, and then we will just start in a moment. Mm. Okay, actually, the purpose of this discussion, because some of the participants are already established, and some of them are in medical school. So the what I have seen in my experience in like I graduated way back in 2004. By the way, I am Sayyid Zishan Javed Hashmi. I am basically from Pakistan, and I have graduated from Allama Iqbal Medical College. And anesthesia was always my passion. So um, I did my fellowship FCPS training from Pakistan, and I came to Saudi Arabia way back in 2011. I was stuck in the exam for quite a bit of time, but finally I passed in end of 2013. And then I passed through different steps to get this position where I'm working right now. I'm working as a consultant in Prince Sultan Military Medical City, which is among like top 4 or 5 institutes in Saudi Arabia. Okay, so like teaching and guiding the people, our juniors, is my passion. So I'm doing it in forum of not only anesthesia. I am like since last 1 year, I have medical students on board, and I just try to give them some clue about what they should do in their career. Okay, so okay, so actually the problem is that like maybe a few years ago, general medicine or general surgery, okay, they used to be a good choice, Paeds medicine. But in last few years, because medical medicine has grown so much that now it's matter of special subspecialties. If we talk about a general surgeon in Pakistan, actually he is doing everything. Even they are doing pediatric surgeries. Even I have seen all not the neonatal surgeries, but a number of pediatric patients they will be doing. Even I have seen some of the general surgeon, they are even draining extradural hematoma. I don't know how they are getting that much confidence. But practically speaking, the general surgery now it's segregated so much. Like you will be finding breast endocrine. I will just try to chalk out how much different apart from the main specialities like urology or orthopedics, okay, or vascular, or cardiac, uh, thoracic, they which were already separate, gynae ops. Okay, but I'm talking about the surgeries which actually are labeled to be the domain of general surgery. But now you see breast endocrine is separate, then hepatobiliary is separate. Okay, and just these uh, acute acute you can say acute emergency surgery is somewhat separate. Then colorectal is separate. Okay, so unfortunately, now if someone is doing training in Pakistan or in any underdeveloped country in general surgery, unfortunately, when they come into international forum, if they are trying to pursue their career even in Gulf, unfortunately, they will have big struggle. There are virtually positions, there are not much of the positions available for general surgeons. Okay, and they will struggle. So right from their start of their career, they should be planning to go in some subspecialty. Of course, these subspecialties are not fully developed in majority of part of the world. Okay, so still they have to struggle. But what they should do, I have few suggestions for them that they should do right during their training. They should try to do USMLE. Okay, and they should try to apply for fellowship in any of them. Okay, because there are subspecialties fellowships in US like transplant surgery, perioperative care, then postoperative ICU. There are so many fellowships for surgical specialties which they can do, and it's their like backdoor enter in US system. They will not be able to get the residency, but if they do fellowship, they can if they are very good, maybe you don't know, they maybe get into the residency pathway. So for that they need to do the USMLE steps, and then they will be applying in the fellowship programs through IRA's website. Okay, and then they can enter in the fellowship system. Then of course, UK Ireland is there. I will be touching the general medicine and pediatric after that. So UK Ireland system is a little bit different. Okay, I have heard people so much obsessed to do MRCS or FRCS. Okay, and there are some European boards in various specialities like surgical oncology, and there are so many subspecialties European boards which are there. Unfortunately, people don't understand these are just exam. They are just exam. They have no value separately. They have no value. It is, but I will give you an example. My neck pillows too cold. Okay. Okay, actually, I try to save my neck. Anyways, Bilal, I would be very happy if you just I will request you to explain the role of internist because in like the people who do internal medicine in US, they have a special role, and you may will if there is nobody else, please I will be requesting you to explain the role of internist in US. Anyways, so just hold on for a while. So actually, these MRCS and FRCS exams, they are just exam. Their example I will give that if you are invited to a dinner, a typical desi dinner, if you are offered sweet dish before food, what you will be thinking? You will be asking, give me where is biryani, where is kadai, where is the main course. So these are all only sweet dish. They are nothing without your basic training. Okay, and even if, for example, someone has done MRCS or FRCS or whatever the exams of surgery they have done, it's actually plus zero. Their main is the main representation is their training program which they have done. Okay, maybe they are from wherever they have got the training. The training certificate matters. Yes, if they want to enter in the system, they just need GMC registration or IMC registration. For that, they don't need to do these exams. Yes, if they are very good, they can do it. I'm not saying they will go give any disadvantage, but actually, if you go cost effective with reference to the effort, with reference to the money or everything, actually, you just need to do PLAB, and then you can apply for a position on the basis of your experience. You will get the job, and then you can compete for the training programs. So it's a long journey. It's not an easy pathway. People think that if they have done MRCS, um, uh, MRCS or FRCS, they will be there. This is a myth. Same is true. I will come to them as well, but same is true for MRCP. MRCP or FRCA, or there are so many exam, FRCR. I have heard MRCOG. Okay, please believe me. Please be very clear. This is just, because we were ruled by the Britishers for so long. Unfortunately, we are still obsessed. We are just respectful whenever we listen anything related to Queen or Royal. We are just go down, unfortunately. Okay. These exams are useless without training. I'm repeating again and again. And actually, the people who try to do MRCP, they should be super, super, super fit if they want to do MRCP. And for example, if someone has done FCPS and then they are doing MRCS or MRCP, okay, it does make any sense. But if they have zero experience, I have seen people who have no experience and they are trying to do MRCP or another exam is very these days, MRC ECM, Member Royal College of Emergency Medicine. Okay, and I am just surprised. MRC GP. These exams are all, if you open, you will find. Yes, yes, yes. I'm just trying to see the comments as well. People say, as good as physician. Yes, I will come to. I will come to because my purpose, because why I am, what incite me, because there was, I was talking to one of the doctor who has done internal medicine, and he was thinking that I will get a very good job in Gulf countries, and she was interested to go to Qatar. And I just told her very clearly, please don't waste your time. You will not get anything if you, because now what is happening, that people who are doing training and they are trying to do UAE exam and Qatar exam and Bahrain exam and Saudi licensing exam, and unfortunately nobody is guiding them. Nobody is guiding them. Even like now entering into a little bit of details of what I am trying to say, the people who are doing FCPS or MCPS or MSMD, okay, and there is actually diploma in anesthesia, diploma in child health, diploma in MRD, medical diagnostics, and there are so many DCH, diploma in chest diseases, DCD. There are so many diplomas. So one, two, three, four categories. Listen, if you want to be competitive, forget about MSMD. Nobody knows about MSMD outside. There will be a question mark at my comment. People are showing the news of dawn. Oh, MSMD program is recognized by Saudi Arabia. Please let them show the Saudi Commission website, the Mamaris Plus, and tell them to show MSMD program entered in their system. When it is entered, okay, thank you very much. I will revert my words. As of today, MSMD, nobody knows about it. Yes, some of the programs in UAE, or maybe they are accepting, they will be getting the job. In 13 years of stay in Saudi Arabia, I have just found one MS anesthesia in Jeddah. I have not met her, uh, only one MS. I have never met anyone of MSMD in Saudi Arabia. Nobody knows. Rather, I was trying to get job for MSMD. Unfortunately, they were asking, what is this? Because they never heard, or they are only hearing about FCPS or MCPS. They never heard of MSMD. And how cruel. Now, I'm sorry, very blunt words about the people who are not guiding the people. MSMD program was introduced by a political malintention, just to malign, just to weaken the role of YDA. Okay, so the purpose was to weaken YDA, and they introduced this central induction policy in Punjab. And actually, still, if you talk about other provinces, nobody knows about MSMD because it's only criminally politically entered in Pakistan, in Punjab. Unfortunately, people are doing 5 years training under the same so-called, unfortunately, I am really sorry to be hard in words, because the people who are supervisor, they are supervisors, they are not supervisors, they are supervisors. I don't know what is their meaning. They are mentors. Unfortunately, they are mento only. They are missing with R. So they are only mentors. They are nothing. I'm sorry. I'm really sorry to be very hard. They don't tell these things. This is not my. I am nobody. I'm nobody. I'm not holding a position of professor. I'm not holding a neck. Yes, neck collar is just to support my neck. I don't have neck. The rods which these supervisors and these mentors and these professors have, they are not approachable. If there is some exception, I salute them. I say thanks to them. But overall, the residents are suffering. The same supervisor will be giving training of so-called training of 5 years to the MSMD and 4 years to FCPS. And I don't know what the hell it is. The same hospital, same system, same supervisor, same third class training, same third class system, and one is getting MSMD, one is getting FCPS. What is this? Like, how can you explain to anyone outside? I'm really sorry. My purpose is not to, because I have no conflict of interest. I'm not talking about the people who are doing their duty sincerely. I have pain for those who don't come out of their rooms, air conditioned rooms. They are controlling remotely. They don't follow what they should. They are not teaching bedside. And okay, if they are doing once in a blue moon, it's not counted, please. And our people, our residents, they don't know their rights. Unfortunately, they don't know their rights. If the supervisor or their professor is open, they are knocking the door and they are going there, and if their supervisor is asking them to sit, oh my god, you made my day. That's what happened actually. If their supervisors are even talking to them, even are looking at them, they are so happy as if uh, मैं था मर जानिया. I'm sorry to be very frank. This is what is happening, because their supervisors, they are not fulfilling their duty, and residents, they are not knowing their rights. Okay, so it's a totally disaster which is going on, and that is the reason, unfortunately, people are doing MSMD program, people are doing MCPS. MCPS should be banned for young people. MCPS is should be for only people who are 50 plus or around 50. They are in a periphery place where even MCPS, they just need a degree. Okay, if any people, any young person who is coming for MCPS, College of Physician Surgeons should ask this horror college. I label it as chronic post surgical pain. It's not College of Physician Surgeon. Sorry. If I talk sincerely about them, unfortunately, they should be asking them why you are doing MCP at age 8 of 27, 28, 25. Why they are doing it? It should be reserved. They should, and I will quote one of a legend in anesthesia way back, maybe 30 years ago. He There was no even diploma. Anesthesia used to be given by technicians, and he did not register himself as MCPS supervisor. He used to push the people to do FCPS at the time, and there was not even diploma holders. Why? Because he had a vision. He doesn't want the his students to waste their time. So that was the motto I'm telling. Yes, some people will say, oh sir, we are not able to pass FCPS part 1. Oh sir, I have a family, I have two kids, I have remember one thing. If you are coming out of your home at a cost of your family, then your time is even more precious. You should not be wasting your time for a degree which will not give you a word as of FCPS. Okay, so please, a humble request to all of you, please spread the message. Don't do MCPS at young age. Go for FCPS, no problem. Spend some more time in preparing for FCPS part 1 and then appear in it. And the problem with FCPS part 1 is that you don't prepare nicely. Have you seen any one of your friend who are preparing for USMLE step 1 failing in FCPS part 1? You will not found anyone, because even they are not reading that terrible pools, the so-called FCPS part 1 pools which are available in the market. And if you ask me, there should be action on the people who are printing it, because they are destroying the concepts, they are destroying the future of the nation. Okay, but unfortunately, what we are talking about, we are talking about a country which has no rule. So what I'm talking, so but still, if you prepare for USMLE step 1, I can guarantee you, you will never fail in FCPS part 1. You don't have to use this word attempt. Attempt. I heard this word from, sir, I am going to attempt FCPS part 1. I'm sorry. Please, please. Why are you wasting 15,000, 20,000 rupees? They are preparing 2 months. Sir, I am doing double job. So I just am taking attempt. So what are you doing? It is not a joke. FCPS part 1 has 4 years course and you want to prepare in for 2 months. How come? And then they become depressed, and then they are getting the results. Sir, I fail on 71%. Sir, I fail on 72%. Sir, I fail in 69%. So it's useless. In medical college, about nobody ask about the percentages. We are on it at either pass or fail. Okay. Nobody asks the percentages. So please, I humbly request all of you, please don't waste your career. Don't plan your career as if you are planning to buy. I'm sorry to give you some slang examples. The girls, how they prepare for a wedding, they get all the bloody information. Oh my God, which color is in, which category, which weather is there, which sort of gentry will be there. Is it of your dear ones? Or so
जी,
how you plan?
जरूर।
You don't go
राहुल
to the
भाई,
market or to wear
क्या हाल है
anything.
आसिफ भाई?
I'm sorry, who someone was talking. I just mute. Anyways, so please just think about everything before going. Prepare yourself, think about your career. Just I have heard for so many people, sir, I was working there and I just was getting a paid seat, so I joined it. I know the social peer pressure. I'm not saying this thing, but please, if you will be wasting your time, at the end of the day, your career will be delayed, your stability will be delayed. And remember one thing, I hear from the people, oh, sir, I have 2 kids, and I have I have to support my family. Yes, you are. I'm not saying that these are not practical things, but if you can still plan, because do you know the real expenditure will come when your elder son or daughter will become at age of 19. Only then you will be, when they will be entering in a professional college, whether it is medical college or engineering college or whatever. At that time you need money. So if you are thinking to get some timely, only quick advantage, ultimately you will be at loss. But if you think about future, plan for next 10 or 15 years where you will be standing, please plan like that. If you are only thinking about short term benefits, okay, maybe you will be getting short term benefits, but at the end of the day you will be lost. So I'm really sorry, because this is very very important. Okay, so I will finish the rest of the topic which I wanted to tell you about, like general medicine and general pediatric medicine, because the same problem is there. If you talk about medicine, there is neurology, there is rheumatology, there is nephrology, there is infectious disease. The medicine has been so, and same is true for pediatrics. So actually, the main thing is that if you are just doing training in internal medicine, please don't waste your time, because internal medicine, unfortunately, has no future internationally. If you are trying to compete in international forum, unfortunately you will not be able to get any job. So if you have any, yes, if you have a plan just to settle in a small periphery area with your wife gynecologist, and you are a physician and you are making a setup and you are having an operation theater, yes, you can do it. No problem. I'm not taking anything away from internal medicine. I'm not saying this thing. But the thing is that if you are planning to move to any other country with internal medicine, I'm sorry, you are a waste. Okay, so this is what I wanted to tell all of you. There is no pediatric medicine. Similarly, it's all pediatric neurology and pediatric nephrology and pediatric cardiology. It's so much integrated that even anesthesia is now going towards that. Already, pediatric anesthesia will be done only by pediatric anesthetists. Cardiac anesthesia is done only by cardiac anesthesia doctors. Okay, pain is also separated. Regional anesthesia is also separated. Even in anesthesia, so much integration has been already done. Or in among the orthopedic, you will be surprised. There is sports medicine, there is trauma. Okay, there is pediatric orthopedics. Okay, at least three of them I can mention. Of course, it's that specialty person can explain to you in details, but it's an era of a subspecialty. I was surprised to hear about a surgeon which I never heard, pediatric surgeon. Do you know, any one of you know about it? What is pediatric surgeon? I had no idea when I came to know. Okay, so actually it's foot surgery. So this is a specialty only for foot surgery. Okay. So up till now, what I wanted to tell you that it's an era of subspecialty. And if my message is listening any of the representative or anyone who can spread this message to CPSP or UHS, please a humble request to all my senior colleagues, please don't misguide our students. Tell them, at least tell them the true path. They should be guided, they should be asked. Yes, in my opinion, they should be asked why you are going to internal medicine, why you are going to general surgery, why you want to do pediatric medicine, general pediatric medicine. Because there should be division. Even if there are some few people only who are working, let them become the supervisor and let them work separately. It's 100% possible. It's 100% possible to disintegrate, no problem. So I don't think so it can be a problem, but for this thing you need to talk to them. They will not tell you, believe me. I'm really sorry, but they will never tell. Because even I was surprised when I was, by the way, by chance I was in Pakistan. I was shocked. I couldn't believe what I heard, that somebody was showing on a beautiful slide CPSP center in Riyadh. That was a reality check for me, and I was surprised. I raised the hand. That gentleman did not know that there is a person roaming around from Riyadh, and I just raised the hand and said, "Where is, sir? I am in South Riyadh since 12 years. Where is the CPSP center in Riyadh?" And can you believe this? He was so stubborn to to prove what he was telling. It was only a non-Pakistani, Egyptian person who was employee of Saudi Commission, and he used to take the papers when there was manual application. He just used to receive the papers and then send it to CPSP. That was his role. And our gentlemen, our big Shimla people, they were showing on the slide, we established CPSP center in Riyadh. Literally, I was hurt. I was shocked. I was embarrassed. I had no words. How can they do this? They are our teacher. They are like our fathers. They are like our elders. How can they do this? Why they are telling the wrong things? Another big thing. We are doing training in Saudi Arabia. By the way, there is no training in Saudi Arabia. This is all wrong information. There is no MOU between Saudi Commission and CPSP. This is all fake. This is wrong information. What has happened that many years ago, when Saudi board was not established, they, as a test case, they come to Pakistan and they selected people right directly from Saudi CPSP, and they took them to Saudi Arabia. This was only one batch. And by the way, there were few, this was my batch. Two of my class fellows did training in Riyadh, and one of them became consultant. Okay. That was the only year. Unfortunately, after that, there was no continuation of a MOU, and they just started selling their positions. Unfortunately, they did not understand that they are doing it without any MOU. How it was opened? Because it took few years for the people who were training here, now applying to Saudi Commission, knock the door, please get us promoted. We have done FCPS. Then they are asking, how come you do a training? And then they are refusing that to get the upgradation from from resident to registrar, or registrar to senior registrar, or senior registrar to consultant. And now, because there are so many people who did training in Saudi Arabia, and it was all without any connection between Saudi Commission and you can yourself think what is going on. Unfortunately, this is very, very unfortunate. Okay. So there are people who are doing training, still they are doing training, but that training is not acceptable, Saudi Commission. This is very unfair, because at any day there can be some action. Because what's the problem? Because in our country there is no system of rotations, unfortunately. If any proper rotations, they are writing 3 months this 3 months 2 months this 1 month this one. It's all, unfortunately, we all know that majority of time it's all cooked. We are not getting the rotations properly. We are just getting the signatures, and that's it. Our supervisors don't make sure that the person whose paper I am signing has done the proper rotations or not. Because how can they do it? There are, I will give you an example. There are cardiac hospitals, PIC, MIC, NICVD. Okay, they are getting training of general anesthesia. Can you believe this? You can only cry on it. I cry. Literally, I feel so bad. I feel embarrassed. There are pediatric hospitals who are giving training of general anesthesia 4 years, and their rotation is maybe 2 months. 2 months. And they are giving training for 48 months. And they claim, oh my God, we are sending you. What are you talking about? We send our people to rotations. So does it make sense? If you have a 48 months training and only 2 months is supposed to be in that hospital, why the hell you are recognizing that hospital? Why? Please wake up, guys. I humbly request you. Please s- talk to the people who are doing the training over there. Please ask this question to the so-called mentors and supervisors. Why you are doing injustice to us? Why you are doing injustice to the people who are doing training in MIC or MPIC? How can they do the training? Pediatric hospital. And I'm shocked. People are doing it. Unfortunately, there are people who are doing training in one hospital. There is no proper rotations. My words are not for the people who are doing proper rotations. My words are for the people who are unable to have the proper rotations, proper training. And it's my moral responsibility to tell you, to guide you. It's not at all not at all to humiliate or pinpoint anyone. It's your right. It's your right. Please don't forego your right. Okay. So I will tell few more things which can help you. All the medical students who are pursuing their career for USMLE, or if even if they are doing PLAB, whatever they are doing AMC. Please do FCPS part 1 and start your training. Don't waste your time, because this is like Sheikh Chulli ka plan. You are not sure what will you get and when will you get. So even if you have done USMLE, PLAB or AMC or whatever you are doing, please do FCPS, start your training. I know so many people who are wasting their time in their hometowns. They are enjoying a honeymoon, okay? And they are wasting their time, unfortunately, because they are waiting for the match, and there is no guarantee the match you will get the match. Okay, I am a big advocate of all of my medical students doing USMLE. All the medical residents, surgical residents, everyone should do USMLE, because even if you are doing training in orthopedics, in anesthesia, in medicine, in surgery, in pediatric, you name anything, still you have a chance. Once you finish your training, you can go there for a fellowship, and this door is open for everyone. Mind it. I know so many people who just I would request Bilal at the end. I'm sure Bilal is here, or he has already left. I think he has already left. Anyways, so I will humbly request you to don't waste your time. You should do FCPS part 1, and you should start doing your training. Okay, and then in the meantime you can do anything. Okay, so this is one message. Don't do MCPS in young age. This is waste of your energy. Don't do diplomas. Only there are people. I can give you example. There are people who are sent on deputation to do diploma, and actually they are wasting their time only for the sake of that government job. What the hell they will do? It is of not, it's not of worth. Yes, I again the same thing. You need to plan your career. If you want only a small momentous advantage, okay, go for it. But at the end of the day, you will lose. You will be stuck. I know so many people who wasted their career because of it. One of my immediate senior, we used to ask for all the guidance for the studies. He did diploma and he is stuck in a very small town. Nothing taking. I'm not saying life will go on. You can spend your life anywhere. Okay, there are people and working anywhere it's not like that. But if you want to use your capabilities, please don't waste your time in young age to do this thing. Go for the best, and no lady will go lose diamond and go for silver or gold. Okay, so why you are wasting yourself for silver or gold when you can get the diamond? So this is my humble request. One more thing, because one of my mentor, my role model is here. I will give him I will request him to speak out something after a few minutes, because there are for surgeons, for surgical fellowships, there are fellowships in Taiwan. Okay, there are fellowships in Singapore. There are fellowships in so many Korea, where yes, you need to pay. Okay, but this will be like your investment, and you can get it back whenever it will be possible. So if the bottom line I'm telling, if someone is planning to come to Gulf only on the basis of FCPS, unfortunately, like for example, few words I want to tell. Cardiology, the cardiology which Pakistani people we are doing is finished. It's either interventional cardiology. Okay, it's either Peds cardiology, or it's electrophysiology, EPS, or I'm sorry, this is Pete's cardiology, electrophysiological study, the EP specialist. Okay, and then there are special boards in echo. So even this is, without this, a simple cardiologist is just a waste. Similarly, radiology. If you talk about radiology, the people who are trained are, and unfortunately, they are only ultrasonologists. They have no worth. Now radiology is changed to interventional radiology. They are doing everything. They are doing neuro, they are doing vascular interventions. So unfortunately, if you are doing training in radiology, if you are not doing any interventions, it's a waste. Okay, so that's a problem. Please raise your voice, go for the subspecialties, make sure CPSP change their curriculum. They don't recognize the institutes which are not fulfilling the requirement. There are some private institute who are receiving. I'm surprised. I was hearing institute in Multan. I'm really shocked to hear that it is recognized for FCPS anesthesia. I can bet on it. It's not worth, and they are just expanding just to please some people. There will be, it's what is happening in Pakistan, unfortunately. And the people who are already established will not be at loss. It is you who will be at loss. It is you, they are already settled, so nothing will happen to them. So you have to make sure, it's your right. It's your problem. It's not their problem. If they are not fulfilling their responsibility, you have to make sure they give your they fulfill, or they give their rights. What you say, Sada hak ithe rakh. So what I can this just say this thing to you. So the summary of what I was telling you: internal medicine, general surgery, pediatric medicine. Unfortunately, in international forum, it is so much disintegrated. So unfortunately, they don't have any proper future now. You have to go into subspecialties. This is number one. Number two, don't go for smaller degree, shorter courses, shortcut, just to get yourself a momentous advantage for short term, at the loss of the long term benefit. Even if you are doing some international programs, you are doing for USMLE, please don't waste your time. Do FCPS right at that time, and go into a training program. Work in a better hospitals rather than just wasting your time in some clinics, which will give you no advantage when you are applying for a job in UK, Ireland, or in US or anywhere. So plan your future. Don't waste your time. Time is money. You will get it back everything. Believe me, the investment of money on studies will never be wasted. You will get it back. I have invested so much time, so much money, which I could have got one home or two, four plots on in that price. But maybe I would not be talking to you in the way I'm talking to you, because I invested a lot of time in studies, and invested a lot of money in studies. And Alhamdulillah, I get a very good result. Despite not being in US or UK, Alhamdulillah, I can say for sure that if you use your time properly, believe me, a very brilliant future is ahead of you. But if you are just trying to do the same shortcut mentality, same nonsense which you are being taught, unfortunately, that just pass the exam, pass the exam. Yes. Oh my God, sir, let us pass the exam. Knowledge will come. No, this is wrong approach. You will never ever be able to. You will never present your family member, your father or your mother or your brother or your sister. Okay, the to be treated by as someone who has just passed the exam from shortcuts. It's serious business, my dear. It's not a joke. It's not a joke. So if you are thinking you are going you want something special for your parents, and you are giving them that material, I'm sorry, this is wrong. Okay, so that's what I wanted to highlight. Please make sure you don't let your supervisor or your so-called teachers sit in their rooms. Bring them out. Don't let them sit over there. Make sure they are with you in the operation theater, in the clinics, in the OR, in the wards. Don't. It's their responsibility. It's their responsibility. Please don't let them. Yes, what happens? They will ask two questions and you will run away. No, don't run away. Don't. What can they do? They cannot kill you. They cannot bring Vigo Dala for you. They cannot do anything. Okay, and you will be humiliated by one thing or other thing. So let's humiliate for the sake of the learning. Make sure that they fulfill the training. Get the printout of the rotations and give it to them. Please, sir, I have not done this thing. I have not this thing. Sir, please, sir, you are my mentor. Sir, you are bring some tears in your eyes. Make sure he cannot run away. It's not his responsibility to just put a three-piece suit and have pictures and Facebook and just only tharak with girls. No, he's not the supervisor for these things. He's supposed to teach you, and don't let him go. I'm sorry, I'm using these words for my senior colleagues, but it is, I have nothing bad for them. And when I talk to them these things, they say, "Oh, you are not in Pakistan and you are talking about us. We are doing everything. We are doing this. We are doing that. Please come here and work." I'm sorry. This is I say Ram Ram. I cannot tolerate their system. This it's a you are there. I'm just requesting them. I'm requesting to all of you to please, if you are in Pakistan, don't waste your time. So thanks a lot for listening to my words, and I would request Dr. Lukman Usman, who is my actually role model. He's a surgeon, and I would like Dr. Lukman, if you can say a few words about, you can freely disagree to what I said, please. Uh, rather, if you are able to add on to something what I was telling, I will be very happy. Yes, sir.
Assalamu alaikum. I think Zishan, you have touched on all the right chords of this debate, because this debate is but the debate is quite complex, about postgraduate medical education and how it should be conducted and how it should be carried out. And then obviously there are so many variables attached to it. It depends on the economy, it depends upon the situation, the site, and obviously the players. We know how the
Sir, sorry
geographical
to interrupt.
entity that we.
Sir, sorry to interrupt. I think your mic is having echo. Are you using headphones?
No, no, I'm not using headphones. I'm
Yes,
just
now it's
using the
better.
mic
Now
only.
it's
Yeah,
better,
yeah, yeah,
please.
yeah.
Now it's
So
better.
because obviously I was studying, and then I found that you had in this session going on. So I said, why not to just to join you and to listen to what you were discussing. Obviously, you have touched all the right chords. The subject that you have touched on is absolutely correct, there are many deficiencies in our part of the world about the postgraduate medical education, and obviously the onus is on the trainees, because they are the ones who will be suffering. They are the suffering end. They have to, keep the things in order. They have to, as you have said everything right. But at the same time, what I will add is that the as I was once a young doctor, and you were also once a young doctor, we had our dreams and aspirations. So all of us, should strive to aim high, and we should aim for perfection and excellence. And that should be our, dream, that we should achieve an excellence. And you're absolutely right that, the generality of specialities, in any specialty, is at the losing end now. The people who are practicing any specialty in its generality, or trying to do everything within some specialty, they are no longer in demand. It's a super specialized world. Everybody needs all the hospitals and institutions. They'll be hiring people who have special skills and special abilities. And if you have, been able to focus yourself in a nice way, it just needs a focus and some sort of sacrifice. It will be there will be a requirement of a sacrifice, but you just need to focus. You need to have a focus, a certain passion for a certain part of your specialty, and keep working on it, and try to develop yourself in that particular area. And you will find yourself that you'll be gathering momentum with time. And I think this is the advice that we can give to any young doctor, as I would say to my own son as well, who is a medical student, that you should be preparing for yourself, your vision about your future, right from the very time that when you are in the medical school, and then when you do your residency. You should be sure that what you want to do, whom you want to sit with, talk to, whom you think should be your mentor, who should be your advisor, and then obviously how should I approach the subject, and how should I move in my career. And obviously, it's not without sacrifice, and the sacrifice initially will be your own individual sacrifice. Then when you get married or have some friendship or use some relationship, you will have a demand on that personality as well to share with you your dream and aspiration. And it's a lifelong process. You just keep on doing it, but don't, as such, as you said, and I totally agree with you. Don't settle for something less. Strive for more, reach for more, ask for more, and do more. And I think you will do it. And I think, Dishan, I think you're doing the right thing of, encouraging the young doctors who are on this platform, telling them how to do it. But obviously, you need to do everything with respect, a lot of understanding of the issue. You need to understand how the things are done, or how the things are being done, what are the reasons why they are being done in this fashion, and obviously try to find your way through, and through this, whatever this confusion may be around you, or may not be around. Try to be with the best people possible. The best people possible, try to have the best company, the best peer, the best mentor. Try to find the right people, and you will find them, and you will find them, and study the journals, go to the conferences, listen to the debates, and probably, the best teacher in these days is the YouTube. YouTube is the best master, best teacher. You have lots of, the opportunities, platforms on the YouTube to listen to watch. So keep and read. Lots of journals are now available. So I think do the best and think more, and and I'm sure you guys are doing absolutely well. There's nothing to be depressed about. The only thing is just try to make a focus on a certain aspect of a specialty and go for it. And that's it. That's all I have to say.
Thank you. Thank you. Actually, there are few points about it's a big problem for people who are stuck in the exam loop. So actually, the thing is that remember one thing, there is so many misconceptions, despite so many arguments regarding training, but the exam of CPSP is of international standards without any doubt. Okay. So if you are not getting past, the problem lies in you, not in the examiners. And you cannot change the examiner. That's a fixed variable. You have to change yourself. Okay, so you always can this Person is here or already left? Yes, so you are still here. So I will tell you that the problem lies in you, because unfortunately, so many people who fail in the exam, they are just trying to find out problems in the examiners. They are not trying to improve their self. Okay, because remember one thing, I did not pass in first attempt. I passed in last attempt in Viva. I had so much mental stress before that. That's why actually that mental stress remain in my heart, and I that's the reason for me to talk to you, because I don't want the to all of you to face the thing which I faced. Okay. And another thing, yes, I was in anesthesia. I used to say by fun that when I came to Saudi Arabia, if 10 people used to apply, 11 people used to get the job. I repeat, if 10 people used to apply, 11 people like virtually everyone used to get job in anesthesia. It just matter. There were so many funny incidents. Once I went to the to an interview and they did not see my papers properly, and that was interview for a specialist. Can you believe this? They let me have an interview, and then he was asking me, when you finish your board, and I said I am third year resident. So so that was a funny moment, that they were so desperate to get people for anesthesia and ICU. But now, unfortunately, even anesthesia is totally filled up. In my hospital, the positions which were actually taken by MCPS, now they are taken by FCPS. So curtains for MCPS in that position. So similarly, as Dr. Lukman also said, make your, at least, you cannot, if you're like, if you just want to have economy class, you will always remain in economy class. Okay. But if you want to have business class, you will have to work hard. You will have to plan your life. If you are just going haphazard, please, it will be a disaster. So, uh, take home message, please don't look for shortcuts. Please, this is the basic rule. Don't
Try to
listen to,
organize yourself.
yes,
Organize yourself.
organize. Everything should
Organize
be
your thoughts.
organized.
Yeah, organize your thoughts, organize your action,
Yes.
and I think you are absolutely right, Zishan. I think you have touched on all the right parts. So
So,
I think those who are on this platform at this moment, I think they are very lucky because you have given them a very good distillate of your own career, how you have shaped your career, and which is really remarkable. And you're such a successful anesthesiologist right now. But it has taken a lot of effort, a lot of hard dedication, hard work, a lot of anguish, a lot of suffering as well. Your individual or your families. Obviously, we are not alone. Everybody has to contribute to our success or failures, or suffer with us in our failures. So I think that's how life is. But I would advise all the young doctors to be very, very focused, very, very organized, have good friendships, have good peers, good mentors, and 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 just try to concentrate, and you will find the way out. As for those who are not passing the exam, remember all exams are meant to be passed. This is the principle. Look, I have given lots of exams, and Dishan knows that, and I passed all of them in my first attempts, and but all of them. So, but the only thing that I feel is that at times there is a feeling, there's a fear in the heart of the candidate, something awful might happen. But at the end of the day, what I've seen is all the examiners, they want to pass the candidate. They don't want him to feel miserable or make him a failure. They all want to give you a good day, a good time. And some or the other, we are the ones, probably because of our inadequate preparation or inadequate focus on the exam. We may have read the subject well, but we are not prepared for that moment about how to do an examination, how to make an analysis, how to do a differential or do some study or do some investigation. So but at the end of the day, all will pass. I'm sure all those who sit for these postgraduate exams ultimately they do earn their degrees and diplomas, and they become successful. It's just a matter of time. So just be positive. I think positivity is very important. You need to keep on yourself on a high dopamine. You need to have a high dopamine, mentality. You need to always, believe that everything good will happen. I will do something right, and I will be managing myself well, and I will organize myself well. And at the end of the day, everybody will win. All exams are meant to pass. All exams are meant to pass. Your struggle starts after the examination. It's never before the examination. Examination is just a milestone. After that, the race begins. Who does the steps right? Who shapes the career well? Who puts in the right effort? Who's focused? Who chased the right target and achieved it? You need to
And
just keep on, very, very passionate.
yes, and one thing, one more thing which I missed, that when you are in when you are in Pakistan, maybe you don't appreciate, okay? But when you are outside country, you are diplomat, you are representative of your country, and if you are not doing anything in a nice way, whole country will be at loss. Okay, there are so many
Absolutely.
people who have done FCPS or any degree, unfortunately, and don't they are not able to represent their country or their degree in a nice way. So that is also very important. Please, again, that's the same reason that I say be an anesthetist or be a doctor who can treat your
Yeah.
own parents. If you are not a doctor who can treat your own parents, unfortunately you are lacking. So please improve yourself. Yes, before I finish, I just wanted to show, Bilal Tufail. He is a role model for so many of you. He did fellowship from Pakistan in anesthesia. He did training in Shaukat Khanam, then he worked in King Faisal. And he was the one who listened to me. Yes, I was not able to do up till now, but it's still, maybe it's like a dream to do USMLE at some point of my life. It's just like a aim, but I want to do anyways. He did a USMLE. He went to US. He did one fellowship in anesthesia. He worked really nicely. They put him only after one fellowship. They put him in the faculty. Now he's working as a consultant anesthesia in New York. So he has a brilliant career ahead.
Very nice. Very
And then
nice. Very,
there are so many people who have done USMLE and
very nice.
were not able to get the match to start with. They did finish their fellowship. They went to US. At least few of them. One of my class fellow is working in nephrology as a consultant.
Very nice.
One of my class fellow, he did in rehabilitative medicine, and he is head of
Very nice.
department. He remained head of department in King Fahd Medical City. Yeah, the one whom you met, Dr. Lukman Ahmad Zahir.
Ah,
So
mashallah, mashallah.
he is one of them. So there are so many people. So that's why I request all of you. USMLE is like a reality check for all of you. So please do it during your training, and you can do it. Don't tell me that you cannot do it. Okay. Instead of wasting your
I think it's
thing,
possible.
so that's an investment which is always worth. So thanks a lot, all of you, for joining. Spread the message, and
Wonderful.
anyone, because this group of us, this make nipping birds blooming flowers, I make it like around 1 year ago. There are around 4,000 medical students, residents, and different variety of people in that group. And we don't have any conflict of interest. Uh, like if someone listen and have any because I use some hard word, but it is not against them, it is for your favor. Okay, because I want you people to wake up and don't waste your energy and time in wrong direction. Get your right. And another thing is that you all are welcome to ask anything anytime. I'm available 24/7. And I have so many
Wonderful.
people like Dr. Lukman, and unfortunately today Dr. Afshan Khatak did not join us. So she's American diplomat in pediatric, and she has
Yeah.
good knowledge. Like one thing which we all lack is research. Unfortunately,
Yeah.
I'm blank in it. So we should be knowing. And another thing is medical education. If possible, this will help you anywhere. And even
Yeah.
if you are trying for US, research is important. Medical education will help you, and even some administrative experience can also help you to get some positions over there. So thank you very much, all of you, and we will meet
Very
inshallah.
good words.
Hopefully, we will
Yeah.
have session by Dr. Lukman on the relationship of mother-in-law and daughter-in-law between a surgeon and an
Yeah.
anesthetist. So, and
Yeah.
hopefully
Sure.
Dr. Lukman will give a note for that session, inshallah, soon.
Yeah.
Okay, sir.
Surely.
Thanks a
Surely.
lot, all of you, and thank all of you
Yeah.
to spend
Yeah.
your
I really
time
enjoyed. I really enjoyed.
and
Yeah.
share the message to
Thank
others.
you.
Thank you very much. Bye bye.
Yeah. Thank you. Take care. Take care. Bye bye.